Okay, hi, it's Dr. Buford. We're just getting started on the right knee. We're looking in the medial compartment here. And we can see the arthritis. You see some of the loose pieces kind of floating around as we turn on the suction. This area here is where you've probably got some loose pieces of cartilage that are flaking off sometimes. You can see how that's a little bit loose. We're just going to, don't want to remove anything. We don't have to, but I don't want to leave anything that's going to be loose in a day or two. Okay. That looks a little better. In terms of the meniscus, we see some wear and tear changes, but other than just a super limited meniscectomy, I don't see much else to do here on the medial side. The story here is mostly the cartilage being soft and generating some loose pieces here, which we continue to see floating around. As we look in the central part of the knee, here's the anterior cruciate ligament. We'll try and get you a better look at this by debriding the ligamentum here. Okay, now we have a much better look at the ACL. Okay, so now we're on the lateral side. We can see some areas of full thickness cartilage loss here. So it's pretty easy to see where these loose pieces are coming from. Try and focus this a little bit. Okay, let me see a straight basket. Again, you can see these edges are just not very stable. Show you some more in just a little bit. Okay, here's what we're left with on the lateral side. You can see it doesn't really look nice and smooth, but that's the hand we're dealt here, so to speak, and that's why we're going to use orthobiologics as long as they're helpful to minimize your pain. But at least we have these things back to stable edges and what looks like something that shouldn't be generating loose pieces anytime soon. We're going to look in the patellofemoral joint next, and we do that just by straightening the knee and looking up here. And as suspected, you've got a big trochlear defect as well. And you've got a lot of unstable cartilage underneath the patella. So, we've got tri-compartment arthritis here, and you're young, so we've got what we call a clinical challenge here to try and keep somebody young and active still with their own knee parts. And we're going to use all our tricks to do that, but I just wanted to get you a good idea of exactly what we're up against here. Good pictures of what we're up against here. So I do want to look in the suprapatellar region to make sure there's no other loose pieces here. But again, on this right knee, we can see exactly why it doesn't always feel great. As we look down in the lateral gutter over here, there's a loose piece there. I think we got the one. We're going to look down a little bit farther. Pull back a little bit on the scope and get all the way down here. Okay, and I think that's it for things we can get to easily. Okay. Okay, this is the medial gutter. Other than some bone spurs, we don't really see any loose pieces here. There's a little something here off the medial side. What's that? Okay, we'll show you some more in a little bit. Okay, so we're done. We've opened up the compartment to make sure there's no more bone spurs trapped, and there's not. Everything here is clear. We've made sure there's really no bleeding to worry about. And let me see the shaver. And we get a really good look of the loss of cartilage here in the patellofemoral joint, which you can see here. This is all the way over to the lateral side over here, so we don't need to really mess with that anymore, but there's no more loose bodies here, as you can see. And as we look up in the suprapatellar pouch, we've taken away all the loose bodies that were floating around up here too. So we're going to finish up on the right knee. We're going to get to work on the left knee next, okay? So good luck to you now on this side. Bye-bye. Okay, so now we're in the left knee, and right out of the gate we're getting a fair number of loose pieces coming to the shaver with suction. We're looking in the anterior portion of the medial compartment here. Okay, that looks pretty good there. We're going to rotate and look towards the posterior portion. Again, you can see the loose piece. You have to push really hard, like your whole body. You can see the loose pieces floating around. We're going to turn on the suction and take these away. And again, work on the femoral condyle up above to make sure there's nothing imminently loose. Okay, here's the central part of the knee. This is where the anterior cruciate ligament is. And you can see you've got some softening on that would be the medial aspect of the lateral femoral condyle here. As we head up towards the trochlea, we're going to look at that in a minute, so we'll stop there. We're going to look in the lateral compartment next. Okay, we're looking in the lateral compartment now. Again, there's some loose pieces here that usually pretty easy to take out just with suction. We're making sure the condyle doesn't have any more loose pieces of cartilage up above. This side of all the compartments we've seen might actually be in the best shape, even though it already has a lot of arthritis too. Okay, so this is the patellofemoral joint, and there's really not much normal cartilage left right here in the central part of the trochlea. This is all kind of eroded and gone. Let's look up at the patella. Again, things are happening on the patella too. So you've really got advanced arthritis in all 6 compartments of the knee that we've looked at today, 3 on each knee. Hopefully we'll buy you many months of relief here with what we're doing. But I'm certain the story's probably not over at this point because you're so young. Okay, we're going to look over here in the medial gutter. That's just a big bone spur. I don't see any other loose pieces. We'll pull back here. Suprapatellar pouch. They have a few little things floating around, but not too bad. Okay. Okay, we're looking the lateral gutter here. If I can get over that spur, there we go. And here's where a bunch of loose pieces are hanging out. You can see those. So we'll put our suction in and see if we can't get to that. Looks like we got most of them. Okay, so we're almost done here. I think this will be the end of the video. I'm going to do a few more little things, but nothing significant. If there is anything else we have to do significant, we'll come back on the video, but I think this is pretty much going to be it. So I'll look back over here one last time. Yeah, and I think we got most of those loose pieces that we saw when we first looked over here. Okay, so good luck to you now. Bye-bye. See that.